Good afternoon and namaste to everyone. I know it's post-lunch session. Many of us must be feeling sleepy, but the topic might have done some work, I believe. This topic, talking about the neurodevelopmental disorder and the reproductive health from a biochemical perspective, I think might be relevant to most of us here in this room, because I see many of us as young students who are later going to be parents, mother, father, and this topic might trigger or may make you think, what can I or what should I be doing differently to shape the life that I would be bringing in future, right? So there are a lot of intricacies or integration that happens between a mother and the fetus when the child is inside her. And I believe this topic will help us lead a better life to shape the better future of a child that would be born. So So why is this topic important? Why are we talking about it today? Right? So if we look from WHO perspective, the first 1,000 days of a child life is considered to be very important. And that 1,000 days starts from conception itself till the second birthday of a child. So, and when we talk about neurodevelopmental disorders, looking back in the 70s and 80s, it was said that 1 in 10,000 babies suffered from neurodevelopmental disorders. But now it is said that 15 to 20% of the children globally are suffering from NDDs. So the incidents we see are rising, and this number might just be the tip of the iceberg. There could be a lot of cases which are underreported because there is a stigma associated with it, because there are no resources available in many parts of the world, including Nepal, where the diagnosis facilities are not available, and many cases might be underreported. So because it's increasing, it's prevalent, we need to understand it. So today I will just be covering very briefly and quickly. You might feel that I'm quite running with the slides because there is quite some to cover. So we will quickly talk about the different stages of brain development and what are the signaling pathways involved. So some important signaling pathways. Then what is the crucial interaction of the maternal biochemistry and the neurodevelopmental disorders, and a few inborn error of metabolism associated with NDDs, and just an overview of this DSM-5 classification of neurodevelopmental disorders and where are we heading in this evolution of genetic tools and diagnostic tools. Where is the future of this diagnosis leading? We will be quickly having a look into that. This is kind of upside down, so it's confusing. Maybe I'll use this one. So starting with the stages of brain development and signaling pathways, it involves marvel of biochemistry involved, and it involves various stages that we will be looking into. And here, the creation of the neurons, the formation of the synaptic connection, insulation of nerve fibers. These are all, for all these stages, what we need is the biochemical process involves a lot of nutrients like folate, like DHA, that is omega-3 fatty acid, thyroid hormones, and signaling pathway like the WNT and SHS signaling pathway that we will be looking into. And the deficiency or toxic exposures can disrupt these stages of the brain development. So first stage, we will be talking about the 5 stages of brain development, and here the weeks are being given, but what we need to understand is there might be the overlapping in the weeks that we see. So first, week 3 to 4, once the baby is conceived, in the first few weeks, up to 4 weeks, there is neural induction and patterning that happens. And in the second stage, the neurogenesis occurs, which happens from week 5 to 30. The third stage is neuronal migration and cortical layering. There will be the formation of 6-layered neocortex. And in the next step, there is synaptogenesis, which begins by week 20, and it goes up even after the baby is born, postnatally. And the final step is myelination, again, which happens during the third trimester, and it keeps continuing even in the postnatal phase of the child. So, in the neural induction and patterning, there are certain biochemical regulators that are needed. One is the sonic hedgehog, which is very crucial in the hedgehog patterning. So, if our brain, if you look, there's an animal called hedgehog. So, our brain takes the shape of that hedgehog with the help of the SHS signaling pathway. And there are other proteins like BMP, retinoic acid gradients, which assist in the head to tail organization of the brain. The second step is neurogenesis. So in neurogenesis, very important nutrient is folate. We all know about folic acid and what is the significance of folic acid to prevent neural tube defect, right? So folate is essential, and there is a very important signaling that takes place. That is the notch signaling that takes place. And a lot of histone modification and DNA methylation plays a crucial role with the DNA, the gene expressions involved in the regulation. The next one is the third stage will be neuronal migration and cortical layering. So the neurons now they migrate to form 6 layers of neocortex, and there is an important extracellular matrix glycoprotein known as reelin, which plays an essential role for this. The fourth step is synaptogenesis. Again, a lot of neurotransmitters, calcium signaling, cell adhesion molecule, and omega-3 fatty acid plays an important role in this process. And the final one is the myelination, and here the cholesterol, sphingolipids, vitamin B12, and very important, the thyroid hormone. So it is very important that the mother's thyroid hormone status should be normal in order to help the baby inside the womb itself to have a healthy brain development. So the 5 stages we have covered, and this is vague, this is complex. I'm not going to go into the signaling cascade, what is actually happening here, but let us just know about these 4 major signaling pathways that happens with the neural development. The one is the WNT signaling pathway, which is willingness related integration site signaling. And it is very important for the anterior posterior patterning of the brain. The SHS signaling is important for the ventral dorsal patterning. The neural progenitor maintenance, the notch signaling is important here. So there is a notch signaling and the neurogenin expression. Neurogenin will promote the differentiation, and notch signaling will inhibit the premature differentiation. So it is important that there is a balance between the two for the proper brain differentiation to happen. And the final one is thyroid hormone. Again, I would like to emphasize this. For the first trimester till the fetus, thyroid glands are not developed. They completely rely on the maternal supply of the thyroid hormone. And it is very important that the mother remains in the euthyroid state so that there is proper synapse development, myelination, and neurotransmitter turnover happening in the fetus. So these 4 signaling pathway we have done. So far we've covered the 5 stages of brain development and the 4 major signaling pathway. And what happens if there is mutation with these pathways or this? So there is a condition known as holoprosencephaly, where this is a rare birth defect where the brain is not dividing properly into the left and the right hemisphere, and it occurs because of the mutation in the Wnt and the SHH signaling pathway. The second one we can see is medulloblastoma. It is the cancer of the cerebellum, which is important for the balance and coordination. This too happens because of the mutation in certain genes. And the third one is the Rett syndrome. So Rett syndrome is one of the monogenic cause for the neurodevelopmental disorder. And in Rett syndrome, there is a mutation of the gene known as MECP2 gene. So it is very important this MECP2 will help, it binds to the methylated DNA and they influence the gene expression. So whenever there is mutation in this MECP2, it leads to a condition known as Rett syndrome. A lot of babies globally are being affected with this condition. We can see that in the babies with the Rett syndrome brain, the brain size is smaller here, and there is reduce in the dendritic complexity of the child affected with Rett syndrome. And again, thyroid hormone disorders, we will be also coming later on, talk about the congenital hypothyroidism, but here, if there is any mutation with the thyroid hormone receptor gene, there will be it will be affecting the neuronal migration, differentiation, myelination, and synaptogenesis. So the development and the signaling pathway is over. Now let's quickly come to the crucial interaction of the maternal biochemistry and the neurodevelopmental for the babies. So here when we talk about the maternal aspect, it is always like we can think of it as healthy womb is always equal to a healthy brain of the fetus. If the mother is not healthy, it will affect the baby in lot of forms, and we will be seeing this under 5 different topics. The first one is the maternal nutritional health. So the maternal nutritional status determines so many conditions in the fetus. So talking about folate itself, the folate, if the maternal folate levels are adequate, it prevents the neural tube defect in the fetus. And it supports the DNA methylation in the rapidly dividing cells, right? So folate helps with the 1 carbon transfer, and it is helping with the methylation of the DNA. And the impact on the brain development is neural tube closure and methylation of the neurodevelopmental gene. So whenever there is folate deficiency, there is neural tube defect seen in the fetus or the baby. Similarly, iron supports the placental growth and oxygen delivery to the baby, and it helps with the neurotransmitter synthesis and myelination of the fetal brain. Iodine, again, is an important micronutrient for thyroid hormone synthesis. So if there is iodine deficiency, the maternal thyroid hormone levels are down, which will affect the fetal brain differentiation and myelination. Similarly, the omega-3 fatty acid, that is the DHA, it helps with placental and fetal membrane health, and it enhances synaptogenesis and the visual cognitive outcome in the fetus. And the zinc, again, zinc improves the maternal ovum quality. It regulates the quality of the oocyte and immunomodulation, and it helps the fetus with the neuron migration antioxidant. And folate, vitamin B12, it works with the folic acid together to support the myelination in the brain and energy. Now coming to the second part, we talked about the maternal nutritional status. The second part is maternal endocrine health. If the mother has certain endocrine disorders, what could be the outcome in the fetus? So again, thyroid hormone. A lot of emphasis is given here because this is the thyroid hormone deficiency in the mother, later leading to congenital hypothyroidism or any other thyroid hormone disorders in the baby. It is one of the most preventable cause of intellectual disability in the babies. So this focus should be always there to make sure that the mother thyroid status is normal, because the T3 and T4 regulates the transcription of the myelin protein and neurotrophic factors in the brain. Similarly, talking about the sex steroid, the estrogen, progesterone, testosterone, they are not just the sex hormones. They are actually helping the fetus with a lot of functions like estrogen. It enhances the placental angiogenesis and the nutrient transport to the fetal brain. Similarly, progesterone, it supports the uterus and supports the immune system, and the androgen level, the testosterone, even in the female fetus, helps regulate the brain sexual differentiation. So it is important that the mother's steroid hormone levels, the sex steroid levels, should be in normal levels. And talking about obesity, if the mother is obese, nowadays obesity is not just simply, being BMI score having higher than the recommended 29 or 30, but obesity is now considered to be as a chronic pro-inflammatory and pro-oxidative condition. In obese women, there is increase in leptin, there is increase in tumor necrosis factor alpha, interleukin, and there is decrease in adiponectin. So all these biochemical disruption, they will cross the placenta and they will increase the reactive oxygen species in the fetus in the womb. And similarly, the other condition, polycystic ovarian syndrome, if the pregnant woman has PCOS, this will lead to insulin resistance, which will again increase the oxidative stress and impairs the placental nutrient transport. And there is a chronic low-grade inflammation happening, which may activate the fetal microglia. So maternal health, being obese, having PCOS, does affect the fetus brain development in numerous ways. Now coming to the third part, the maternal infection, toxic and inflammatory states. So infection, one most common that we see that is associated with microcephaly, a lot of brain developmental impairment is torch infection. If the mother has torch infection, it directly damages the fetal brain tissue and it interrupts the biochemical signaling. So whenever mother has any sort of severe infection, that it will lead to maternal immune activation, and this activation will increase the interleukins and it disrupts the brain, fetal brain cytokine balance, and it will also alter the signaling pathway in the fetus brain. And hence there is an increased risk of schizophrenia and ASC in the baby once they are born. Now, environmental toxin and endocrine disruption, lead, mercury, pesticides, they all affect the synaptogenesis, neurotransmitter function, and signaling pathway. And there is a chemical known as BPA, the bisphenol A, which is seen in the plastic. If the mother is consuming water or food from low grade on the low grade plastic, then the BPA is going to interfere with the estrogen signaling. That will affect the fetal brain differentiation. Mother taking alcohol will lead to fetal alcohol spectrum disorder. And there is a drug known as thalidomide, which is associated with fecomalia. So whatever the mother is consuming, in a way, it's directly affecting the fetus. So here we can see this is a typical facial feature of fetal alcohol distress syndrome here. There is a smooth philtrum. The philtrum is very smooth. And yes, this is how the torch infection leads to microcephaly, and that is thalidomide and fecomalia. That is seen. Now coming to the fourth one, that is the placental health and reproductive neurodevelopmental bridge. So placenta is not just considered as a passive structure nowadays. It is considered to be an entire organ, endocrine organ, which is biochemically active. It is synthesizing steroid hormones, thyroid hormone regulators, and a lot of neurotropic factors, which is preventing the fetus brain. So whenever there is placental inflammation, especially when seen in preeclampsia, that is hypertension in pregnancy, will lead to the placental inflammation, which will alter the nutrients and oxygen supply to the fetus, thus reducing the fetal brain oxygenation. Similarly, in gestational diabetes mellitus, the hyperglycemia induces oxidative stress that will lead to the epigenetic reprogramming in the fetus. So after this, the final one is epigenetic genetic programming. And we all know what is epigenetic. It is stable but reversible change in the gene function without alteration to the underlying DNA sequence. And the epigenetic environment of the fetus is determined to a huge extent by the diet that the mother is taking. Even the stress level, even if the mother is way too stressful throughout her pregnancy, studies have found that later the child is affected with certain conditions like ADHD, anxiety, and impulsivity. So here there is one study and finding that cortisol, if the mother is way too stressed in her pregnancy, the cortisol level in her is way too high. That cortisol level will go to the fetus through the placenta, and they will inhibit this 11 beta hydroxysteroid dehydrogenase enzyme, and that enzyme is actually protecting the fetus from the high level of cortisol. But since the cortisol level is too high in the mother, the enzyme is inactive and the fetus is now not protected from high level of cortisol that it is being exposed from the mother's blood. And this will lead to a lot of condition in the fetus later on. So there are a lot of epigenetic mechanisms. I'm not going to go into the detail, but the three major mechanisms are DNA methylation, which is involved in the gene silencing, the histone modification, and non-coding RNA, which will inhibit the mRNA translation to promote the degradation. So We are done with the five major aspects looking at the mothers and the fetus integration. So there are certain genes which leads to neurodevelopmental disorders which are affected through the epigenetic pathways. So I just want to bring quickly about few studies which might help us understand the significance of what we have studied so far. So there was a study in 25,216 pregnant women who were untreated, who had untreated subclinical hypothyroidism, and these babies who were born to the subclinical hypothyroid mother had 7-point lower IQ in children by the age 7 to 9 years. So this is the impact that mother having hypothyroidism is leading to causing the baby. Similarly, folate deficiency leading to neural tube defect. So those mother who had neural tube defect affected pregnancy, when they were given peri-conceptional folic acid supplementation, there was 72% reduction in the neural tube defect in the subsequent pregnancy. So there is a fortification program that happens also in Nepal, that every pregnant woman is given folic acid, and nowadays also there's a studies which says that if a woman is planning pregnancy, it's better to take folate supplement 6 months prior to planning the pregnancy, not after the, by what happens in Nepal is they come to the doctor by the end of first trimester knowing that their cycles have been missed, and by the time it might be too late already. So those women who are planning consciously for pregnancy, it's suggested to take folate supplement 6 months prior. Gestational diabetes mellitus and autism spectrum disorders. There was a large cohort study with 322,000 mothers where the GDM diagnosed before 26 weeks led to 42% increase in the risk of autism spectrum disorder and ADHD in the offspring. And there is another study with maternal obesity and ADHD risk factor increased. And intrauterine exposure to Zika virus led to microcephaly because Zika virus was targeting the neural progenitor cells in the fetus, triggering the apoptosis and decreasing the neural production. The preeclampsia, placental insufficiency, and brain damage. Infants born to mother with early onset preeclampsia shows decrease in the muscle tone and abnormal neurobehavioral profile in the fetus. So the study goes, there is a study linking maternal state and infant brain connectivity, how the maternal stress and anxiety and elevated cortisol level affected the amygdala prefrontal cortex connectivity in the fetus. There is a study with maternal iron level and NTD's outcome. And there is a universal screening now that happens with hemoglobin and serum ferritin during pregnancy. And we also in Nepal do suggest the pregnant women for iron supplementation because iron deficiency has shown to cause hypomyelination, increase in the dopamine and serotonin level, decrease hippocampal plasticity, and decrease attention span in the babies. So a lot of studies have already proven that the maternal nutritional state, the health of the mother determines the baby's health. So when we nourish the reproductive health, we shape not only lives, but we shape the mind of the babies. So it is not just about fertility and getting pregnant or pregnancy outcome. Reproductive health, it's a foundational determinants of child's lifelong neurological health, cognitive ability, and mental well-being. So when we understand these molecular bridges, it helps us promote the maternal micronutrient supplement, encourage preconceptional care, and identify early biomarker for neurodevelopmental risk. I know we are very short of time, so I will just go quickly into 1 or 2 slides, each of the remaining here. So in one error of metabolism, we all know there is a defect in the biochemical pathway that would lead to either the product deficiency or the substrate accumulation, which would take to form a toxic metabolite which will affect the baby. And there are a lot of conditions here that has been listed which will lead to alteration in the brain function of the baby. Like amino acid disorders, they are numerous, like phenylketonuria, there is a accumulation of this amino acid which are neurotoxic to the brain. The fatty acid oxidation defect will lead to encephalopathy. The urea cycle defect, because the ammonia is not being converted to urea in the urea cycle defect way. So what is happening is the ammonia is crossing the blood-brain barrier and leading to cerebral edema. So a lot of condition, and again here congenital hypothyroidism needs a special attention because it is one of the most preventable cause of intellectual disability in the pediatric population. And the treatment of this condition is very simple, just a levothyroxine tablet, and the child does very well. But the clause is the child needs to be detected very early. If the child is diagnosed within first 2 weeks of life, he or she might develop as a normal child. But the more the delay in diagnosis, there might be irreversible brain damage that occurs. And unfortunately, because the child appears very healthy at birth, no parents can detect congenital hypothyroidism. They think that their child is completely fine. But by the time that the child is 6 months, 8 months, there is a decline in their developmental milestone, which might lead to now suspicion. And by the time they are there to the doctor, the damage has already happened. So earlier the diagnosis, better outcome, neurological outcome for the baby. The DSM-5 and the neurodevelopmental disorder, starting from DSM-1, 2, 3, 4, the latest one, and the current one that is being followed for the classification of neurodevelopmental disorder is DSM-5. And DSM stands for Diagnostic and Statistical Manual of Mental Disorders. So this is the latest edition, and they have defined neurodevelopmental disorders as a group of conditions that onset in the developmental period, and they typically manifest early, often by age 5. And here the important diagnostic criteria is initially just the IQ was given focus. So IQ is low, the child is said to have a developmental disorder. But currently in the new diagnostic criteria, the emphasis is also given in the adaptive functioning of the child. So adaptive function is also important, and the severity is determined by both adaptive functioning rather than the IQ score alone. So there are classification of neurodevelopmental disorders, not going into the detail of this, but they classify it as intellectual disability and autism spectrum disorders, ADHD, that is attention deficit hyperactivity disorder, the communication disorder, the learning disability, there are motor disorders and other neurodevelopment. So total of 7 categories they have given. So just the ADHD, here there is difficulty in sustaining focus by the baby, and the child is very active, and this should happen, at least the symptoms should last for at least 6 months to diagnose a child to have ADHD. Okay, just because the child is happy and active all the time does not give us the diagnosis, but at least for 6 months if it is old. Similarly, intellectual disability, we do not use the term mental retardation nowadays. It has been replaced by intellectual disability, and here the IQ is below 70 to 75. There is significant limitation again here. The focus is in the adaptive skills. Here at the condition manifests before the age of 18. And the causes are, it could be the causes for intellectual disability could be prenatal, that is a lot of chromosomes are involved. So Down syndrome is one of the most common. The chromosome 5 deletion syndrome, that is the 3-2 chance syndrome here. And Fragile X syndrome is considered to be the most common hereditary cause of intellectual disability. And beside this, there is Klinefelter syndrome and Donner syndrome that might lead to neurodevelopmental disability. And in perinatal cause, low birth weight, anoxia, if the oxygen supply is deprived for longer time in babies, that might lead to it. And again, the postnatal cause could be the environmental cause. And the autism, talking about briefly about autism spectrum disorders, here 2 major criteria that needs to be considered. One is there is persistent deficit in the social communication and social interaction, and there is restrictive and repetitive patterns of behavior, interest, or activity. So the first symptoms that might be seen is there is delayed language, lack of social interest, or unusual social interaction, and it is typically recognized by the 2 years of life. And if you look from the DSM-5 criteria, here autism is not just one single condition. Now it is renamed as autism spectrum disorders, and there are a lot of conditions that might come under this spectrum. So one is autistic disorder, the Asperger's disorder. Everything has been integrated as one under one umbrella as autism spectrum disorder, rather than just calling it as autism. And it has 1/3 of the babies have increased serotonin levels. So this is the first marker, biomarker identified for autism. And there is the hyperdopaminurgic activity noted. And how far are we in the new molecular or genetic classification? So, sometimes the mother might come to us saying that, the diet was taken care of, there was no stress, everything was uneventful, yet the child is born with certain genetic condition which leads to neurodevelopmental disorders. And what could be the cause? And there was a study that was done. So there was a study, big study, that is the DDD studies, the Deciphering Developmental Disorder study, which was conducted in 2017. They looked at the DNA of over 7,000 families who had a child with neurodevelopmental disorders, and they found that 42% of the people with developmental disorder had harmful new mutation. So there are de novo mutation that happens, the sporadic de novo mutation that might lead to the neurodevelopmental disorder. So there is like genetic transmission of a gene, or there might be de novo mutation that might happen in the baby, which might lead to the neurodevelopmental disorder that is seen. And initially, what was thought was a child, like if there is one condition, that is it, like intellectual disability or communication error. But now it is said that it is a continuum model of neurodevelopmental disorder. It is a new paradigm. So there is a spectrum that happens. So if we see 22 to 83% of the children with ASD will meet the criteria for ADHD. So there is overlapping of the symptoms. So there is a frequent coexistence of the conditions that is seen, and that needs to be considered. Traditionally, it was phenotype first approach. So example, a child has an intellectual disability, that the gene is being tested, you find a mutation and you diagnose the child. But now the forward genetics, from the forward genetics, the modern approach is reverse genetics. So what is done here is from a gene or chromosomal location, it begins there, you look at thousands genes together, and then it identifies the gene function via molecular pathway, and from the mutation, you identify what is the problem in the child. So it is from forward genetic, it is moving to reverse phenotyping now. And there are a lot of technology that has been developed, like BEST, whole exome sequencing and whole genome sequencing, which is revealing both new genes and it is helping to understand the neurodevelopmental complexity. And this is the final slide. In the recent literature, there is a condition known as Renew syndrome. And this Renew syndrome is because of the mutation in the RNU42 gene, and lot of babies globally with neurodevelopmental disorders. Now, this is the newest disorders that has been added and has been discovered. So with this, very quickly, we have talked about the stages of the brain development, the signaling pathway, how the maternal health was connected to the fetus brain development. We talked about few IEMs like congenital hypothyroidism and amino acid disorders and associated with NDDs. We talked about the DSM classification and the neurodevelopmental disorders, how it was classified. And finally, the de novo mutation part, the forward genetics to reverse phenotyping approach has been dealt. And I would be happy to answer any questions. Thank you so much. And once again, I would like to thank Dr. Santosh for this opportunity. And I hope the topic was able to at least ignite some questions in your head or in your mind. Happy to answer any questions.